raise awareness around this important issue that affects Milwaukee County, the city of Milwaukee, and all of the spaces around us. So we again thank you for being here as we have some great individuals who are going to speak from their perspective of why this is important and why we are going to be here at City Hall throughout the week, where we'll have tables and different vendors and individuals will be here with harm reduction supplies and products for you to come and grab hold of. And we also have our memorial tree that we'll be able to have you come, and if you have a loved one you would like to remember, you can definitely take time to do that. We'll have supplies for you to add to the tree, which unfortunately has numbers of individuals added to each and every year. We are grateful, though, that we are able to say that this year the number of lives lost has decreased by 30% from last year. And so even though it's decreased, we still know the work has to be done. And we know that we have to continue to move forward and continue to push this effort of prevention and harm reduction. So to kick us off, I would like to introduce the mayor of our city, Cavalier Johnson.
Great, thank you. All right. Well, good morning, everyone, and thank you so much for being here and covering this very important topic. International Overdose Awareness Day, it's a time to be thoughtful, it's a time to be aware, and it's also a time for all of us, each and every single person, to be compassionate, because human lives are a loss, human lives are at stake, and as people in our community and around the world deal with substance use disorder, we've got to remember those folks. In Milwaukee, we've lost literally thousands and thousands of lives to this. Now, these folks are sons, their daughters, their brothers, their sisters, their neighbors, and they're our friends. Some trends, as was mentioned, point to fewer deaths, and while that may be true, every single individual, every single death in our community, we consider that a loss. Every single one is a loss. Every individual overdose is an opportunity for all of us to have a call to action, to do more, to do something about this issue that's facing our community. And there are so many people who step up. And I want to call out two city departments in particular, the Milwaukee Fire Department, and you'll hear from Chief Lipsky in just a moment, as well as the Milwaukee Health Department. Both of these city agencies have answered the call, and they've worked collaboratively over the years with our partners in order to help to reduce the frequency and consequences that we see from substance misuse. I also want to add my voice to those working to reduce the stigma of substance use disorder here in our community. We should not, and more than should not, in fact we cannot dismiss any human being when intervention can be a life-saving tool. So as we mark Overdose Awareness Day, we ought to remember that collective actions can certainly make a difference. And speaking of collective actions, it's my pleasure now to introduce my friend and a partner in working to make this a stronger and healthier community for us all. Ladies and gentlemen, that's Milwaukee County Executive David Crowley. So, County Executive.
Well, good morning. I want to say thank you to everyone who is here. I want to say thank you to Mayor Johnson for that introduction, but as well as his partnership. I also want to say thank you to the folks who are behind me. We have healthcare providers, we have harm reduction experts, and passionate community members who are joining us today as we gather in advance of International Overdose Awareness Day on August 31st. But this is really a time for many of us to remember the lives who have been lost, to recognize that there are still folks out there who are still struggling with addiction, but also to recommit ourselves to really taking action to continue to help save lives. When we look at this year's theme, it is unity and action. And I can't think of a message that better reflects the work happening all across the entire county of Milwaukee. I want folks to know that my administration, we're focused on building stronger partnerships because we know that we cannot tackle any one issue on our own, especially not something as large and complex as overdose deaths. And for me, this issue is deeply personal. You know, growing up as a kid, watching both of my parents struggle with their own addiction. And so while I know that that experience was not necessarily easy for me, it has given me a great understanding, deep understanding of what many families and children are facing all throughout our entire community. But also, and a determination to do everything that I can to make sure that no other child has to grow up in those same circumstances. But even now, community events that I attend all across Milwaukee County, we see people struggling. I see people struggling. Addiction is not abstract. It is real, it is here, and it is negatively affecting not just our neighbors, but our coworkers, our friends, and our families. And while we have made progress with expanding programs and access to things like naloxone or placing harm reduction vending machines throughout our region, investing in behavioral health resources and strengthening our community-based programs through the opioid settlement dollars, we know that there is so much more work for us all to do. But I will say that I am hopeful. I am hopeful because of the incredible team that we have at Milwaukee County and the powerful partnerships that we have built with organizations, with healthcare providers, and community leaders who are here today, who are here to work, but more importantly, here to save lives. And all of us know that this particular crisis, this is not about criminalizing those who are taking drugs. That needs to be crystal clear. Because when that happens, it prohibits people from truly seeking the help that they absolutely need. This is really about how do we address the root causes? How do we address the social, health, and economic factors that drive addiction in our community? It's about preventing it before it happens. But when it does, we must also be ready to help those who are affected by giving them the support that they need to recover and to avoid any level of relapse. Because again, as the mayor stated, these statistics aren't just numbers. These are actual lives. And so when I'm out there, I get a chance to talk to a lot of people. I hear their stories. They tell me about their friends, their family members, their loved ones who they're cared for, but how they want to make sure that they're there for them in that moment. And so that's what this is all about. This is about unity in action. Unity because none of us can do this work alone, but also action because so many lives depend on it. So together, I'm excited to be here because I know that we can tackle this challenge, and I know that together we can save lives. And so I'm going to ask the mayor to come back up and join me. Because we both have executive proclamations, and I know they pretty much read the same thing, so I'll just read a few lines. I'll let the mayor start off with his, and then I'll read a few.
All right, thank you, Mr. County Executive. First two lines I'll read. Whereas the City of Milwaukee joins Milwaukee organizations, advocates, and community members in recognizing International Overdose Awareness Day on Sunday, August 31st, 2025, and whereas International Overdose Awareness Day is an opportunity to raise awareness, remember, and grieve the lives lost to overdose, and support the individuals and families left behind.
And then I'll read a few lines, and it says, whereas International Overdose Awareness Day was first established in 2001 by Sally J. Finn at the Salvation Army in St. Kilda, Melbourne, and has since grown into a global movement by the Pennington Institute, an Australian public health nonprofit organization dedicated to saving lives and reducing harm. And I, David Crowley, County Executive of Milwaukee County, and the Mayor.
And I, Cavalier Johnson, Mayor of the City of Milwaukee,
do hereby proclaim August 31st, 2025 to be International Overdose Awareness Day. Thanks to your resolution.
Thank you, County Exec Crawley. Thank you, Mayor Johnson. We thank you for recognizing the importance of this and sharing your thoughts and your words to help us move forward the awareness of International Overdose Awareness Day. With that, we will also now hear from our Milwaukee Fire Chief, Aaron Lipsky, and following Chief Lipsky, you will hear from Marcus Hogan of the City of Milwaukee Health Department.
Thank you. I'm Aaron Lipsky, Fire Chief, City of the Milwaukee Fire Department. I'm also the current chair of RISE Drug-Free MKE, which is a multiversal collaborative of folks from all walks of life, every sector, public, private, public health, et cetera, coming together to fight this problem. So let's talk about the problem. Insidious. We describe this problem as insidious. 30% reduction of record-breaking numbers is good. It's going the right direction, but the numbers are far too high. What we need to also acknowledge is that while the fatal overdoses are dropping, which that is the low watermark for this, is to stop people dying from overdoses. The underlying problem is that people are still overdosing in record numbers. The market has been absolutely flooded through the unified efforts of everybody you see here and a whole bunch more with Narcan, naloxone, hope kits, so that if people are around somebody that is overdosing, they can intercede right away and they can keep the person alive. So the problem is insidious. We all know that. Nobody's shying away from that. In fact, everybody here is unified. They've galvanized their efforts to push back and start solving the problems. One may be inclined to think that all these different overlapping government structures and public and private and this department, that department, are just all bouncing around doing their own things. When in fact, this is evidence right here of a unity that I have not seen prior to this. We've got the city, we've got the county, we've got the Milwaukee Health Department, we've got counties, DHS, we've got incredible community partners here, we've got clinicians, we've got healthcare specialists, we've got everything in the mix coming at this problem. We have got to keep the pedal down. I am extremely fortunate to be a part of the action coming from that unity with the Milwaukee Fire Department. I get to observe the Milwaukee Overdose Response Initiative practitioners that you see behind me. These are the folks that go out post-overdose and they ask one simple question, and that question is, are you ready? It's a very, very fragile, brittle time for somebody that is overdosed immediately following a resuscitation. And oftentimes, it's a moment of clarity where they go, yes, I want to live. And we can get them to medically assisted treatment. We can get them to the proper therapies and the proper cares. This is so crucial. It is not good enough anymore to just keep going on 911 calls, waking a person up and sending them on their way. We have got to close the loop on the other side, and that's what all these folks back here are so fantastic at. I would point out that here in the city, a lot of that action has been very, very possible because of strong leadership and collaboration between our mayor, between our common council, between the fire department. We work with the Milwaukee Health Department. Commissioner Todoritis is one of the most forward-thinking, progressive individuals I've ever met. And we are looking at this from our respective different angles, and in that, we can see more of the problem. And just very happy to work with the health department and with Commissioner Todoritis. But here as we head into International Overdose Awareness Day, let us never forget the sad, sad thousands and thousands of people that have lost the battle and the ones left behind for them. Thank you.
Good morning, everyone. Thanks to Chief Lipsky, Mayor Johnson, County Executive Crowley for pitching up the event for today. Because we know today is a day of mourning, a day of celebration. We mourn the lives that were lost, but we celebrate the lives that we were able to live with those individuals. And so as we look at the issue is that Milwaukee and communities across the U.S. are looking at opioids and trying to find ways to address the issue, right? And so we know that the issue extends beyond the individual, but also to the generations that are to come. And we recognize that the action has to be swift and steady, right? We have to be able to respond to the needs today, but also address the needs that are coming down the line to sustain the care. In the city, we're hoping to save lives. We're hoping to establish the efforts and change the interventions that improve community health. We are building, leveraging, and standing up public health infrastructure, looking at the data, looking at the reasons why overdose exists, looking at the root causes. We're looking at how the approach needs to take a public health stance. So we're talking about leaning into health promotion across the spectrum, whether it's family, community, society. We're looking at prevention, whether it's selective, across the spectrum, and we're looking at evidence-based practices. How do we use what has happened before, what has helped before, to really leverage and change the outcomes of people that are experiencing substance use overdose? Additionally, long-term and sustainability. The things that we want to accomplish, we need to have last for a long time so that the burden doesn't continue to affect our communities. Fortunately, we have a community that's rich in collaboration. We have partners that are addressing the needs, like to hear Samai's House or UMOS. We have those available to really change the impact. We have access to harm reduction supplies. Come see the health department, come see the other providers. We have Narcan, naloxone. We have fentanyl test strips. We have xylazine test strips to make sure users are being safe with using. And we're saving lives, as Chief said. To prevent a fatal overdose is to save a life. And to reaffirm, we want to look at the epidemic to reduce inequities across our communities. We want to focus our attention on tailoring resources to those that are most needed, those that have been most impacted, those that have exacerbated outcomes. We want to lessen the burden. Additionally, as we lead up to the days of International Overdose Awareness Day, the events that lead up to the day, like I said, we want to recognize the mourning of lives lost to substance use, celebrate the lives that they live, and we stand in solidarity with the families, the friends, the neighbors, the co-workers that have experienced substance use loss. Bring your compassion, bring your need for help, demonstrate support, and we want to have an impact on this issue, on this lasting issue. Thank you.
Now it is my honor to bring up one of our leaders of Rise Drug-Free MKE, as well as a beautiful human being and community member who runs Samai's House, which is a great organization that helps this harm reduction effort in so many ways, along with the work that they're doing with the Milwaukee Community Collective. I would like to now bring up Tahira Malik.
Good morning, everyone. I'd like to begin by thanking Mayor Johnson, County Exec Crowley, Fire Chief Aaron Lipsky, Marcus Hogan with Milwaukee Health Department, Deshaun Ewing with Rise Drug-Free Milwaukee and Community Advocates Public Policy Institute, Maury. We all, as the City and County of Milwaukee, come together to address the need. In 2022, there were 674 fatal drug overdose deaths. In 2023, we reduced that number by 1% to 652 deaths. And by the efforts of boots on the ground, we were able in 2024 to reduce the drug overdose deaths by 30%. That is all attributed. That is all attributed to all of the people you see behind me. We do not work in silos. We come from behind the walls. We make sure that we're pushing litigation up at the Capitol, on the state level, and on the federal level. And we have so many other community partners who are out in the field right now trying to save lives. We have work still to be done. International Overdose Awareness Day is a day that we remember the lives that we lost in the struggle. We also want to make people understand the power of naloxone, the power to be able to save a life by carrying naloxone. We stand here today to say let's normalize carrying naloxone in our bags. in our glove box, in our purses, please, because you never know when you have that power to be able to bring someone back from a drug overdose. This year's theme for International Overdose Day is driven by hope. We continue to allow that hope. We continue to allow that hope to be able to save a life. We keep that wind behind our wings to be able to provide hope to our communities. We normalize the conversation surrounding addiction because we can't provide hope if we're not able to be relatable and personable to individuals. We meet people exactly where they are, meaning in their recovery or in their addiction. To be able to see the Milwaukee Overdose Response Initiative work in action is a true sight to see. I've called on them on many a days to provide assistance to people we meet, and they'll take them directly to treatment, just like anyone else standing behind us. So we invite the community out. We're doing 2 separate events because we do recognize it's Labor Day weekend. So we do invite the community out on Friday to Mitchell Park for our Driven of Hope drive. We're gonna have poetry sessions. What we always try to provide is a space of healing, a space of compassion, a space of listening. Because if you've ever lost someone, number 1 to death, but number 2 to drug overdose death, you need to not judge and just listen. So we provide those safe spaces for our community. Mitchell Park from 5 until 7 p.m. on Friday, August 29th. And on Sunday, August 31st, we will be at Washington Park, picnic area 2 and 3, to provide a safe space to just talk, to just listen, to just provide love. So again, we're declining, but we have so much more work to do. Let's continue to provide hope to our community. Thank you.
Thank you, Tahira. Thank you to all of our speakers, our guests, our members of community who stand behind each other each and every day, who stand next to each other each and every day in the trenches. We are grateful for you being here. Tahira did invite you to our 2 events, one on Friday at Mitchell Park from 5 to 8, and then we also have Washington Park on the 31st from 5:30 to 7. I also want to invite you, if you're able to, make your way down to City Hall, because we do have people that will be here with materials for you, resources for you. We have naloxone that will be here throughout the week. And we also have an opportunity, if you're interested in filling out a medallion for a loved one, someone that you want to remember. And we will add this to the tree that you see here. So you also have that opportunity throughout the week. These items will be here for you. So we thank you. We thank you again for raising awareness in your community. Speak to your loved ones and let them know that this is a day that we want to honor our loved ones that we've lost. Also celebrate the lives that have been saved and those who have not died of overdose. But we also know the importance of having people to talk to, having community and having network. So again, we hope to see you on Friday, on Sunday, and even down here at City Hall throughout the week. Do we have any questions at this time?
I guess just, say someone's not able to get to these 2 events, Friday and Sunday, what personally can someone in Milwaukee do to help forward the mission of International Overdose Day?
Did anyone want to speak to that? I'll go do myself.
Couple things you can do. Tahira covered it best, referring to Narcan as hope. Get your hands on some Narcan. Where? You can go many places you can get Narcan. Any fire station, if you approach any fire truck or paramedic unit and say, hey, can I get some Narcan? No questions asked. We're not keeping records. We just want it in everybody's hands. Police Department, Milwaukee County Sheriff's Department, the Milwaukee Health Department are all able to provide this. One of Tahira's efforts is boxes that look like basically a little newspaper box with Narcan. You can just open the box and take it. Milwaukee County has the vending machines in many, many locations. Again, you just go up, you can get the Narcan right out of it. Milwaukee County Office of Emergency Management has done a fantastic job of dashboarding this situation across the county. And they also have a map on there which will get you right to where you can get Narcan. At no cost. You don't need to be a chemist to use it right. That's the life-saving beauty of it, is that anybody can use it. So that's what I would say. Get your hands on the Narcan, and then you can perhaps participate in keeping someone alive.
Thank you, Chief. And in addition to that, I would also say, as a community, we can educate ourselves, really understand overdose and understand drug addiction and the science of it. Also making sure that we are reducing the stigma, right? Being able to speak to overdose not as something that we should be ashamed of. Not to speak of addiction as something we should be ashamed of, but to speak of it as a sickness, as an illness, as someone's suffering with and suffering through. But we also know that there's hope, as Tahira mentioned, that there's hope at the end of the day, and we are driven by that hope. So, as Chief mentioned, we do have a vending machine at Community Advocates right on James Lovell in Wisconsin. If you're interested in coming to get Narcan and some other items out of that vending machine, no questions asked. We just want people to have access to the tools that we know can save lives. We also have gun locks in those vending machines. We also have some other items such as medication lock bags. So please come and support by supporting our community and getting those items. Again, I'm Deshaun Ewing of Community Advocates, Public Policy Institute, and I am just honored to be in the presence of these wonderful people who allow us to continue to save and help community. If there are no other questions, I will let you go on about your day, and thank you so much for spreading the word, spreading the message, and we are indeed driven by hope.